Welcome to the Explainer. If you're studying for the NCLEX, you know that schizophrenia questions are practically a guarantee. They can be tricky, for sure, so in the next few minutes, we're going to cut right through all the noise and focus on exactly what you need to know to assess, intervene, and, well, get the question right.
Okay, first things first. Let's just clear up the biggest misconception out there. Schizophrenia is not multiple personalities. That's a totally different diagnosis. What we're actually talking about is a brain disorder where a person's connection to reality can become, well, fractured.
So, here's our game plan. We'll start by going beyond the myths. Then we'll break down positive versus negative symptoms, super important for exams. After that, we'll walk through a mental status exam, cover the key nursing interventions you need to know, and wrap up with the path to recovery. All right, let's dive in with a clear clinical definition. Really understanding what this condition is and what it isn't is the foundation for providing safe and effective care.
Here's the most important takeaway. Think of this as a brain disease, not some kind of character flaw. It creates very real problems with thinking, feeling, and behaving. And for us as nurses, that disconnect from reality is what really drives our focus on safety.
Next up, let's decode the symptoms. For the NCLEX, you absolutely 100% have to know the difference between positive and negative symptoms. So let's break that down right now.
This is such a core concept, and here's the easiest way to think about it. It's like simple math. Positive symptoms add things to the person that shouldn't be there, like hearing voices. Negative symptoms subtract or take away normal abilities, like motivation or showing emotion.
So hallucinations are false sensory perceptions. And while they can affect any of the senses, auditory hallucinations, hearing voices, are by far the most common. And as we're about to see, these voices can sometimes give commands, which is a major red flag for safety.
Delusions are a bit different. These are false, fixed beliefs that just don't change, even when you present evidence to the contrary. A patient might believe the CIA is monitoring them. That's persecutory. Or that they're a world-famous celebrity. That's grandiose. The key thing for us to remember is we never argue with the delusion, because for the patient, it is 100% real.
Now, for those negative symptoms, which can be a little harder to remember, here's a fantastic mnemonic for your exam, the 6 A's. This covers things like avolition, which is a profound lack of motivation, or anhedonia, the inability to feel pleasure from things you used to enjoy. Honestly, these are often the symptoms that make daily life so incredibly challenging for patients.
Okay, we know the symptoms. So how do we actually assess for them? Well, your number one tool in your toolkit is the Mental Status Examination, or MSE. Let's walk through it. Think of this as your systematic checklist, like a head-to-toe assessment, but for mental status. You're observing everything from their hygiene, which might give you a clue about avolition, to their thought process, where you're listening for disorganized speech or delusions. And always remember that key difference. Mood is what the patient says they feel, while affect is the emotional expression you actually see. So, you've done your assessment. You have all this data. Now what do? This is exactly where NCLEX questions love to focus. What is the nurse's priority action? These are going to be your big-ticket nursing diagnoses that will drive your whole care plan. And notice a pattern? They connect directly back to the symptoms we just talked about. Hallucinations lead to disturbed sensory perception, while certain delusions can lead to risk for violence. Safety is always our number one concern.
Okay, let's put this into practice with a classic exam-style question. A patient tells you they are hearing voices that are telling them to do things. What is the very first thing you must do? Your answer here is absolutely critical for keeping your patient safe.
The answer, every single time, is to assess the content. You have to know what the voices are telling them. Are they telling the patient to hurt themselves or to hurt someone else? That is a direct safety assessment, and it is always your first move. So these are your go-to techniques for communication. You might say something like, "I don't hear any voices, but I can see that this is very frightening for you." See what that does? It acknowledges their feeling without agreeing with the hallucination. Simple things, like turning down the TV, can also really help decrease agitation. And remember, you always have to adapt your communication. With older adults, for example, who might have other things going on cognitively, using simple phrases and doing shorter, more frequent check-ins can cut through confusion and help you build that all-important therapeutic trust. Okay, finally, let's talk about the why behind all of this work. Let's look at the long-term outlook and the incredible impact that really effective nursing care can have on a person's life.
Now, while it's true that schizophrenia is a lifelong illness, I never want you to forget this number, 25%. That represents so much hope. It shows that with consistent, effective treatment, a full recovery is possible for many people. They can manage their symptoms, go to work, and lead really fulfilling lives.
And this is what that effective treatment looks like. It's a combination approach. Of course, we have medication to help manage brain chemistry. But just as important are therapies like cognitive behavioral therapy, or CBT, to help reframe thoughts, and support systems like assertive community treatment, or ACT, which provide comprehensive care right there in the community.
So, the key takeaway from all of this is that your role as a nurse is absolutely central. You're not just giving out meds. You are the one who's building trust, ensuring safety, and providing that non-judgmental support that empowers a patient to navigate this disease and find their own path to recovery.